I just have one suggestion for you. Instead of free, say public.
Yeah.
This, every time you hear, oh, they want things free. No, we pay taxes.
Yeah.
And those who are profiting from our school don't pay taxes. That's our taxes. So let's not call it free. So next week, we're gonna have this young lady from Birmingham State, Professor Ishara Mills Henry. She's a chemistry professor and tons of things to say.
Thank you. So as a chemistry professor, this is my usual lecture that I would give, but I have to say Jonathan King was my graduate school mentor, and he not only taught us how to be good scientists, he taught us to always think about moral and ethic responsibility as a scientist, and I really appreciate that. Now I've been at Framingham State for 8 years, and I can tell you, being an advisor to a lot of these students, exactly what has been said here is happening. Students are choosing between paying their rent and paying their tuition. They're working 40-hour weeks, which I cannot even understand how they can do full loads. So you're in class, 16 hours a week, additional homework and all these other responsibilities, and you have to work a 40-hour week job just to get by. And it's just devastating to me looking at the potential that students have and just realizing that there's just not enough time. It's just not possible for them to maintain this type of schedule. And talking to them about it and saying, well, I don't know what else I could do because I just don't have the money. And so I know I'm talking about also biomedical research, and you know, this ties in because these are the students we're training to be the future scientists that are going to tackle the ailments that we have as a society, but also we were talking about climate change, right? These are our future scientists and engineers, and they need their proper training, and they need to be focused on being trained to pursue these careers. And what's happening is they're falling into a lot of debt, and it's taking them longer because they don't have the time that they really need, and they have to retake classes, etc. So, you know, thank you for inviting me today. I don't know how much more I can add, but I just wanted to at least put that perspective out here first. I just wanted to say, for many serious diseases afflicting Massachusetts residents, we have a couple including Alzheimer's, cancer, heart disease, stroke. The best health care cannot prevent these diseases or alleviate its advances. We have to invest in coming up with more therapies and cures for these diseases. And so in order to do that, we need to think about funding biomedical research. And funding biomedical research is quite separate from financing healthcare. And as you can see, I brought this back up, thanks to Jonathan, he sent me the slap. And you can see, of course, the military, the bloated military budget. And then if you look at NIH, so that's the National Institutes of Health. And many researchers receive their funding from NIH to study various diseases. And so you see that that's 34 billion, 3%. And then National Science Foundation is also where researchers find their funding. And so you might say, well, okay, that's not a lot, but still a significant portion. So consider this. Consider just for Alzheimer's disease, last year, let's see if I can get my, I'm gonna put this up research. So last year, about 130,000 Massachusetts seniors were diagnosed with Alzheimer's. A lot of these included veterans who are getting older, and these victims require some 330,000 people to provide care, so you need those resources. We talked about the VA earlier, and this costs Medicare $1.6 billion. So $1.6 billion with Alzheimer's alone. So the toll in human suffering and the loss in productive life is staggering. So we're looking at just one disease, and one disease annually costs $1 billion. And they're giving $34 billion for researchers to study all of the ailments and all of the diseases that we have as a society. And it seems ridiculous, right? So we're paying more for treating the symptoms than we are for trying to find the cure. And it's really backwards, right? The thinking is backwards. So thinking about this in terms of universities and medical schools, Massachusetts, of course, we're sort of at, or at least a huge hub for research, and so we can use a lot of our universities and medical schools to develop therapies and prevent diseases like Alzheimer's. Almost none of the state budget is actually devoted to this goal. So almost none of the state budget actually goes to research that's happening in our universities and college systems. Most of this all, again, is dependent on the research grants from the federal level at the NIH and NSF. Okay, so these grants are crucial, and this is important because this funds a lot of things. So you might think, well, okay, that's funding the scientist research, but it's also funding the people who work in there. I was actually supported by one of the federal grants. So when I was trained as a graduate student and as a postdoc, I was actually funded through the NIH. But this is also goes beyond that because it supports other workers that are at the university, and therefore it contributes to our communities. So it's crucial to expand this funding, not only for the federal level, but at Massachusetts as well. Okay, I have 1 minute left. This went really fast. Okay, so there's a couple of points that I just wanted to make as far as thinking about the budget. So it says what Massachusetts and the nation really need is about a 25% increase in the federal NIH budget. From the current $40 billion, which is less than 4%, as you saw, is about 3%. If we could get to at least $50 billion, that still would be less than 5% of the total, and we would at least with $10 billion have more money that goes towards improving the funding for these therapies. Given the fact that we had this $738 billion for war, we've talked about that, $10 million an increased national research budget would be a pittance. So that would be hardly anything, a drop in the bucket compared to that, the funding that's going towards the Pentagon. So thinking about education as well, right? For the state universities, so not like the UMass system, I think I had some figures for UMass, but they get a lot of their, again, money through NIH, but for the other colleges and universities, including community colleges, we get most of our money from the state. We, honestly, we support a lot more low-income and English language learners and first-generation students. I think at Framingham State this year, we had over 50% that were first-generation students. And therefore, our budget has to also be increased to provide resources for these students. I'm out of time. Thank you very much.